Hi everyone, welcome to Rakesh sir lecture, and today we are going to see about hypermetropia. So we are going to see the brief about hypermetropia. Anyway, in detailed lectures we'll be seeing in some other classes, but today just to know about what are the causes and symptom sign and how will you manage this hypermetropia in brief. Okay, so in this we are going to see about what is the definition of hypermetropia. Then we are going to see about what are the causes of hypermetropia. Then we are going to see about symptoms of hypermetropia. Then we are going to see about sign of hypermetropia. Then how will you manage it? Management. Okay, management of hypermetropia. So how will you define it? Hypermetropia. So here, to define hypermetropia, first let me draw the diagram. So this is a schematic diagram of eye. When the light coming from infinity strikes the cornea, and after striking the cornea, if this light is getting focused behind the retina, this is the retinal plane, right? So if this is the retinal plane, if the light is getting focused behind the retina, when this accommodation is not active, when the lens is at rest position, so such refractive status is known as hypermetropia. So let us define it. So when light coming from infinity, definitions, right? So when light coming from infinity, or you can put it when parallel ray of light, okay? When parallel ray of light, when parallel ray of light coming from infinity strikes the cornea, and after refraction through the cornea, and after refraction through the cornea, and after refraction through the cornea and other ocular optical element, and after refraction through the cornea and other ocular optical element like aqueous lens and vitreous humor, these are all ocular optical element where the light is passing. So other ocular element, if the light ray get focused behind the retina in a single point, remember that is very important, behind the retina, when accommodation is at rest. So such refractive condition is known as hypermetropia. Right, such refractive condition is known as hypermetropia. So remember, the things highlighted should be is accommodation should be as rates, hypermetropia. Okay, understood? So when parallel ray of light coming from infinity strikes the cornea, and after refraction through the cornea and all other optical element, if the light is getting focused behind the retina, this is behind the retina in a single point, when accommodation is at rest, when lens is at rest, such refractive condition is known as hypermetropia. The point to be remembered is here all the meridian light ray, either vertical meridian light ray, horizontal meridian light ray, or oblique meridian light ray, all the light ray will focus at a single point behind the retina. Okay, so this is known as hypermetropia. What could be the cause of this? Okay, the causes of this will be when the light is passing and falling behind, that means their converging power is less, their plus power is less, their maybe the corneal plus power is less, right? So when the corneal power is decreases, when the corneal power decreases, then it will cause hypermetropia. If increases, it will cause myopia. We have seen in earlier classes, right? So here corneal curvature increases or corneal power increases, either curvature, both means the same, corneal curvature or corneal power, or radius of curvature of cornea decreases. This is decreases. So radius of curvature, if decrease, only curvature will increase. Here what we seen? Sorry, this is I'm talking about in the case of myopia. Let me correct myself. Okay. See, if the corneal power decreases or corneal curvature decreases, both mean the same. So if corneal curvature decreases, that means light is focusing behind, converging power decreases. So here I can write here is, if corneal curvature or power decreases, it will cause hypermetropia. Or radius of curvature, if power decreases means radius of curvature increases. Okay, if radius of curvature, anyway some other lecture as of now we will leave it, radius of curvature increase, then curvature will decrease. This is inversely proportional. Okay, other causes will be, sometimes the power will remain same, sometimes this power of the cornea remains same, although it will cause hypermetropia because the size of the eyeball, maybe normal eye is up to here, okay, retina is up to here, but if because of the decrease in the size of the eye, the eyeball now decreases, so ultimately light is focusing behind the retina. So if the eyeball size decreases, it will cause hypermetropia. So here I can put as is decrease in axial length of eye. Axial length means from cornea to retina. This length is known as axial length. Okay. So I will erase as of now, not to make it crowded. So decrease in axial length of eye. Other is, we can see that in earlier classes we have seen that this lens has two components. One is central component, central structure is called nucleus, and this peripheral structures, this is called as cortex. Okay, so when the cortex density increases, when you have cortical cataract, okay, so if the cortex density increases, it will cause hypermetropia. So here increases density of cortex of lens, cortex of crystalline lens, cortex of crystalline lens, or other name is cortical cataract or cortical cataract, right? So that will also cause hypermetropia. Rarely it is hereditary, but of course it is hereditary. So we have seen definitions, we have seen causes. Now we'll go for the symptom. So what you feel, what could be the symptoms of this person, someone is having hypermetropia? Okay, first symptom, it is asymptomatic. It is asymptomatic when this why it is asymptomatic means most of the time when the light is falling behind and you can increase the power of the lens, you have that facility given by the nature or God to you, you can increase the plus power of the lens. You can increase the plus power of the lens. So once you increase the plus power of the lens, this that means converging power increases, so light will get converged onto the retina. Okay, so and you will see the things clearly from the far also, light coming from the far. Ultimately, with the help of accommodation, light will come on the retina, right? So that means when the light is coming from far and with the help of the increase in lens power, light is coming on the retina, so that means you are able to see the distant object, but you will not have difficulty in blurring a vision. Okay, you are able to see the distant object also in the hypermetropia, right, because of increase in lens power, and that mechanism is called accommodation. Okay, so here I can write here symptom. So first symptom is asymptomatic. It is asymptomatic. Okay, it is asymptomatic. And second is, then if this hypermetropia increases further, if the hypermetropia increases further, then it is what we'll call it as, then there will be blurring of vision for distance. Because if the hypermetropia increases further, then this, even if you increase the plus power of the lens, you cannot bring it on the retina. So that much, if the degree of hypermetropia is very very high, so that time, if with the help of accommodation also, if you cannot bring the hypermetropia into the retina, so that time you can that means that time the light ray will not focus on the retina. That time you will feel blurring of vision for distance. So first stage it is asymptomatic. Later you will feel blurring of vision for distance. Then of course, if blurring of vision of distance is there, then blurring of vision for near also will be there. Okay. Then in hypermetropia, when you are seeing distance, once you open the eye, of course you have to see some things. So when you are seeing distance, then if this light ray is falling behind, and with the help of this lens, light is brought onto the retina. That means in hypermetropia, continuously the lens is working, lens is active. That leads the tiredness of muscles, which is helping to do so, right? So that means hypermetropia, they will have headache and all because of the tiredness, or they will get eye fatigueness. So the eye will get tired easily because continuously the lens is active, continuously all the time, because all the light which is coming from either from near or from distance, they has to brought, the lens has to increase the power and the light has to brought onto the retina. That means continuously the lens is active. Because of that, it will develop as a asthenopic symptom. They will develop headache, eye strain, eye pain, okay, eye fatigueness. So they will get a asthenopic symptom. Okay, asthenopic symptom is a group of symptoms which includes eye pain, eye strain, right? Eye pain, eye strain. They will have headache, eye fatigueness. Sometimes they will have motion sickness. When they are traveling, they will have motion sickness, right? Drowsiness, they will have drowsiness. So these all symptoms will be present in the hypermetropia. What you feel like? What could be the sign? How will you identify this? Huh? How will you identify sign? Same whatever we have learned in myopia, same thing will put for hypermetropia. So autorefractometer, AR will tell autorefractometer. AR shows hypermetropia. Then this retinoscopy. Retinoscopy shows hypermetropia. Same I'll put here, hypermetropia. Even when you do keratometry, then you find that this cornea has less power, right? Cornea has less power. So if it is because of decrease in corneal curvature, if the hypermetropia is because of decrease in corneal curvature, then you can tell it is that this is because of refractive metropia, that is refractive hypermetropia. So decrease in corneal curvature, so you can find it out by keratometry. Keratometry shows what? Keratometry shows decrease in curvature or decreases corneal curvature or increases radius of curvature of cornea. Radius of curvature of cornea. Okay. So corneal curvature decreases and increase in the radius of curvature of cornea. Others in axial length in A scan. Okay, A scan, when you do A scan is an instrument. A scan shows decrease in axial length. Eyeball is small in this. So A scan shows decreases in axial length. A scan shows decrease in axial length. So I can put here decrease in axial length. Axial length of eye, right? In which instrument is to detect this? A scan. Okay. How will you manage this? Management. How will you manage this? So first is by using convex lens. By using convex lens, that is plus lens. See here, if I use plus lens here, that means plus lens will converge, and this will makes this light point to come here. So this will converge and light will be like this. Okay, the light will fall on the retina. This can also be done with the help of contact lens. Instead of placing plus lens here, you put plus lens here. Okay, so if you keep plus lens here at this plane, so this is contact lens. So either you give this or this, both you can do, right? But I am drawing in the simple single diagram. Okay, so this is plus lens. So when you are giving contact lens, you remove this one, glasses. So now this contact lens, CL, I can put here contact lens. So if you give plus power contact lens, then of course the same effect will be there. Light will brought up to the retina. So by using convex lens, either the mode of correction will be through so here I can write mode of correction. Mode of correction, either you can prescribe glasses, right, a spectacle, or either you can prescribe contact lens, or it can go for refractive surgery. surgery. In refractive surgery, the corneal curvature need to, the power should increase because plus power should be added, right? So they will do surgery in such a way that power should increase. Okay. Again, I will tell in detail. I will go later in hypermetropia in detail, very detail. We'll have separate lectures only on hypermetropia. Even I have left types because types of hypermetropia is very important to understand. So just for the brief, I have gone through this. So this completes the brief of hypermetropia. I hope you have understood this lecture, and coming classes will be brief about the astigmatism, and then we'll go in detail about all the three types of refractive anomalies, that is myopia in very in detail, hypermetropia in detail, and astigmatism again in detail. So first coming classes will be on astigmatism in brief. Astigmatism in brief. So this completes our hypermetropia. If you feel this lecture is informative, please do like, share and subscribe this channel. Thank you.